and today there are 4 new infections of this virus, and that also includes a Hungarian diplomat, which appears to be another local transmission. And the CCSA revealed today a Hungarian diplomat in Thailand is among 4 new COVID-19 cases recorded in the country today. The 53-year-old unidentified diplomat who lives in Bangkok is reported to have been in close contact with a visiting Hungarian minister who was found to be infected with COVID-19 on November 3rd and has already left for home. The diplomat, who remains to be asymptomatic, has been admitted to Bamranaradun State Hospital for treatment. At the same time, the Sukhothai residences released a statement today that one of the residents has tested positive for COVID-19. The resident was in contact with a COVID-19 positive individual, according to the statement, and has been in self-quarantine in his unit since November 3rd. It also said that staff members had no direct contact with this person and nobody has entered his unit during his quarantine. However, it is suspected that this resident might have come down to the lobby area on November 4th to collect his food. It further states that government authorities will investigate the situation at the building to see whether the resident has come into contact with anybody else at the time. The 3 other infections today include a 50-year-old American, the manager of a private company, arriving from the United States and entering hotel-based quarantine in Bangkok, a 38-year-old Indian hotel employee arriving from India and also in hotel-based quarantine in Bangkok, and a 27-year-old Thai woman arriving from Sweden and in hotel quarantine in Bangkok. The 4 new cases today brought the total number of infections in Thailand to 3,844, with 9 new recoveries and no new fatalities. And meanwhile, there have been no cases of COVID-19 among the 3 groups of foreign tourists who arrived in Thailand on special tourist visas. The director of the Communicable Diseases Division, Dr. Sopon Iemsirithawon, revealed that the first and the second group of Chinese tourists have completed their 14-day quarantine and have been cleared free of the virus. The last group of tourists who arrived on October 28th are still in quarantine and are due to complete their isolation today. However, Dr. Sopon urged the public to maintain all health and safety practices. He also warned that quarantine alone will not keep the country safe, stating that the most recent cases in Thailand were among returnees who appeared to have been asymptomatic for long periods of time, possibly even the duration of their quarantine. The department has raised its alert level after 2 particular cases. The first, a French woman who tested positive a week after leaving her assigned quarantine facility, and the second, an Indian man who worked in a restaurant in Krabi, as we mentioned yesterday. Dr. Sopon said that as restrictions are eased to stimulate the economy, especially for those coming from countries considered low risk, the Communicable Diseases Division is committed to reminding people to remain vigilant as the pandemic is far from over in many parts of the world. Regarding the travel bubble program with countries regarded as low risk, Dr. Sopon said that tourists from such countries must have a fit-to-fly health certificate issued 72 hours before departure. They must also wear face masks throughout the journey, must go through health screening, quarantine, and tests in accordance with standard procedures, and install the tracing app upon arrival in Thailand.